Hey everybody, Dr. Adam Vega here again with the Nifty Thrifty Dentist Podcast. And you know what we're doing? We're bringing the faces of Facebook to you so you can learn about all these amazing people out there.
Before we get into this next episode, I'd like to give a shout out to one of our sponsors, MVP Mailhouse. Now, mailers have been around for a long time, but not any company can do direct mail for dental practices the way MVP Mailhouse does it. Check them out. Make sure you ask for a Nifty Thrifty deal.
The guest we have here today, I've had the privilege of working with in the past, and we had a relationship for just about a year. We talked every week. We went through, and this guy, I think he's taught me more than I've ever taught him. And so we got Dr. Travis Coulter here. He's doing crazy things. You probably have used some of the things he's had before, and if you haven't, you're going to after this that he's putting out into the world. And so thank you for joining us here today, Travis, and tell me a little bit about you and where you're from and your background.
Thank you for saying all that stuff. By the way, anybody who's listening, Adam is such a great guy, and he's totally full of it. Like, this guy is like massively taught me so much. Like, it's completely the inverse of what he just said. But yeah, thank you for that. I really appreciate you taking the time to chat with me. So me, I'm a farm kid from Texas that got lucky, and I feel crazy blessed to be in a profession, to be able to help people, work with people, meet new people, and make a difference in the world. It's just fun and exciting. I love it. I live in Spokane, Washington, practice in Spokane, Washington. My life is heavily focused around my two amazing kids. I got a boy and a girl, both in junior high. I feel so blessed. They're the best kids in the world. Sorry to anybody else have kids, but mine, they're the best. Yeah. So they're even involved in the practice here in regards to, like, everything in my life revolves around dentistry, and yeah, it's served me well, and I feel very blessed. Yeah, it's been great.
There you go, man. I love it. And so we met, I guess it's been a couple years ago now. We're getting moving, and you've got a practice, amazing practice. You're one of the advanced level dentists in our profession, IV sedation, big surgeries, things like that. And you were coming to us to try to figure out how you can start to get yourself out of the practice so that you can do other things, right? And so you've got XChart. He's got a different company where he manufactures like machine parts. I don't even know how it works. He got into that. And I'm going to rat him out right now because he's in a sound room. Okay. But he's actually sitting on a toilet right now because this guy,
that's just behind me.
the toilet's behind him. And so this guy has so many things going on top of the dentistry and so many different passions that he had to build himself a room within his practice to be able to do all of these other things that he has. So give me a little bit of background about your dentistry, how you ended up in your practice, and then dive into like XChart and where that goes. Let me know where your life is and how you ended up where you are right now, sitting on a toilet talking to me, man.
I'll try and keep the extracurricular noises to a minimum. So graduating from dental school 07 on a whim, took a road trip, found Spokane, Washington, absolutely loved it. I judged it based on the fact of, like, the people were really awesome, as close to blue collar Texans as I could get, but actually still have clear water and mountains and streams. So committed, moved here, and got hired by a group, or a doc that was an anesthesiologist. And man, that's what exposed me to the beauty and the joy and what an amazing service sedation and anesthesia can be to all sorts of different walks of life. And it sparked a huge passion in me, and I knew that there was no way I could ever go back. Of course, still, big majority of the dentistry we do is awake, but I absolutely love the sedation aspect of it. So as associate for 3 years, bought my own practice in 2010, went through all the highs and lows and drama and everything and anything like that. And there was just enough stuff that happened that I committed to myself. I thought, man, there was nobody at that point willing to be my mentor, be my coach, help me through, say like, "Ooh, you don't want to do this. You should do this," anything like that. It was just like fjording the dark black seas by myself. And I realized at that moment, like I'd heard the term how in dentistry we eat our young. And I also realized like, oh, I just got ate, because I just kicked into somebody's retirement with very little in return. And I was like, I don't ever want to be a part of that. I want to try and stop that trend. I want to share anything, no matter what it is, whether it's something that, mistake that I made, a negative outcome, positive outcome, skill set, whatever the case may be. I actually want to share it instead of just sequestering it. And I knew that someday I was going to sell my practice, transition over, whatever the case may be. And I committed to myself right then and there that I wanted to do absolutely everything the opposite of what happened to me. And I wanted to bring in docs or a doc, whatever the case may be, and them be very proud to be a part of what we were doing and feel like they're being treated correctly, ideally. And I guess you would have to ask my associates if they feel like I'm accomplishing that.
Yeah.
But I hope that I am. I feel like that I am. Um, and I mean, for one, they're the best two docs that I could have ever asked to work with. Personality wise, skill wise, just great people. And the fact that they choose to work with me every day and come to this office is just, it's huge. It's phenomenal. It's what allows me to split off and do all of my other interests, of which you mentioned the XChart. So that that was a little side project that I thought was just going to be just a little hobby, but now has turned into, dare I say, way more of my life even than just clinical dentistry. Uh, just like anything else that ever gets invented, need is the father of all invention. And there's so many things that I was super frustrated about by using paper to record all of our sedations and anesthesia appointments. And it just so happens one of my best friends is a crazy hotshot, just genius. And I'm not saying that as a compliment. I mean, this guy's off the charts IQ level. Um, Hopefully he doesn't hear this. His head might get a little big, but um, he and I ended up partnering up, and that allowed us to have 100% control of every little strip of code. And it's been an amazing journey and partnership for us to be able to put clinicians, providers, and patients first, and then develop software around that versus the classic, oh, let's develop a software and try and convince all of our providers to use what we've made because this is how we know how to make it. Um, and yeah, there's so many issues that we were trying to solve, and of course I was just thinking a tool, but then we realized we actually developed something that can help an individual, a provider that has just now started off in sedation, walk them through, use like baseline off of like that book, Checklist Manifesto. Fantastic read. If you haven't read it, I suggest everybody go read that book. Using checklists to help us through making sure we don't have errors of omissions, walking through that uncomfortable provider to make sure that they remember all the correct steps and everything's in compliance. And then, of course, your record ends up being beautiful and whatnot, and represents that high quality job that you've put into it and that effort that you've put into it. Because we all need to be represented correctly. And if we care about what we do, our records should represent it. And that then morphed to realize that we had a platform that could create efficiencies for our doctors, could reduce costs of employment to our doctors, and allow providers to switch their focus onto their patients significantly more than concerning about records. And then you start throwing in their emergency preparedness and awareness, and I can go on and on and on and on about that. So I'm very passionate about that as well. And realize like the more attention we could put on a patient, especially in a sedation situation, the higher likelihood of a positive outcome that we have. And who doesn't want that? If you have happy patients, happy doctors, It's a really good thing. And helping people out with compliance, it's a very gratifying thing. And when I get emails from CRNAs and anesthesiologists telling me that they had a significant emergency mega code and they were able to take that record because it's up to the minute accurate. They're not having to scramble around trying to pull things together when the paramedics arrived, and they actually have the record sent to the hospital, arrives at the hospital before the patient even gets there, and the emergency department says that they were able to go through, read everything, had full understanding of timing, exactly what was given and how much. And so they felt prepared triaging before that patient even arrived there. And they specifically said they felt like the outcome for that patient was better just because of that. That's the sort of stuff that drives me. That's the stuff that pushes us as a company, like, let's be even better and better and better. Because if we are actually changing the outcome for patients in their life, that's what it's all about. And it's just fantastic to be able to serve people and indirectly serve the patients in that regards.
Your passion, I mean, it's inspiring just watching you talk about it. And I could see, you pulling yourself back in, trying to stay on task, because you're like, I could go down this avenue. I could talk passionately about that. I could talk about this. And anybody watching, I mean, that's this guy. I mean, his heart is as big as could be. His brain is probably at least that big, if not bigger. And he's wanting to make a difference. So if you're doing IV sedation, if you're doing anything like that, if you're giving local anesthetic, which we're going to link to something he was talking about here as well, the stuff he's developing will help you be a better clinician, will help you along your path, and ultimately do great things for our patients. That's what we're all about, right? So his passion,
Yeah.
please, I know he's sitting on a toilet doing an interview, but if you reach out to him, he will respond. He will help you. He will do
Absolutely.
whatever he can. And so I want to kind of take all that passion and all this stuff that you're doing outside of dentistry and take it back into your practice. You're talking about
Yeah.
trying to be a great boss as well.
Yeah.
How do you feel like all these other things that you're doing, right? Things that are drawing your attention away from your practice. How do you think that helps actually support your practice, to support you building what you're doing while you're still doing all these other things?
Uh, that's a great question. My if you haven't picked up on it yet, I'm like full blown ADHD, and it's like like the girls here call me a Roomba vacuum cleaner. I'm like, give me enough time, I'll clean the whole room up, but I'm just like all over the place, all over the place.
Mhm.
Uh, and that alone has been very challenging because you can, I'm that little wind up toy, like, "Whoa, wind me up, point me in a direction," I take off. But yet now all of a sudden, if I'm like, ooh, I've got this, I got to manage. Oh, like I got to help out my associate here, and oh, well, the front here, and this and that. And when I was smaller and just one provider for two hygienists and two assistants and two front, I of course thought things were challenging then. But wow, I think back on that. Those days were pretty straightforward and easy because I'd show up to work and it's all on me. And I know some people might think, oh man, that's not what I want. But in reality, I felt like, well, I can be the resource for motivation. I can be the resource for the energy input. And if I can work harder, then that means the whole team's working harder. And so because I have control over everything, like we all like that control. And then when you start growing because you feel like, oh, that's the right thing to do, then you get more and more players in the picture, and then it gets more and more difficult. The the book Extreme Ownership, again, another fantastic read. Love that book. Where it mentions in there in regards to how the military has done studies into the psyche of leaders, and technically, no matter your IQ level, ideally you only have five people underneath you as management, maybe six, but five is ideal. And I saw that and I was like, whoa. At that point, I had 10 when I came exposed to that. And so I thought, okay, like I need to figure out to divide and conquer. And so then that's when I actually admitted I needed a manager, and ended up bringing up a team member to help me out with that. And it made life so much better, but it was more expensive. And so then you got to make up for that. And you're the smart one as far as like KPIs and learning all that. And like that's where like you came in to save my bacon, because I'm like, I can work hard like crazy. Like I'm fine. I got the energy to do it. But geez, man, like give me some direction. Which man, plug to Adam, like this guy on point. Like coached me huge. Um, but in bringing on more people, I started to come to the realization that the skill set that we're taught in dental school, and then of course we continue our education, life just whack hits you. And I remember being in dental school and all the other dentists like, you're gonna learn more in the first 6 months than you did all 4 years in dental school. I'm like, yeah, right, whatever. I'm like, I'm super great at school. Like, no, it's true. It's just like like, and we've all been there, and that's fine and great. But those skill sets you get to where you're just like, it's old hat. You know, you're sitting there prepping a crown or doing an extraction. You're thinking about your grocery list. You know, like you're not sitting there stressing out about that. So the actual skill sets of what we do, other than a few isolated times of like needing hyper focus, it's not that insanely difficult. What is the challenge is the people around you and having them all be on the same page as you, be with you in your mission, and showing up with good attitudes, showing up saying like, no matter what, this ship's going down, we're going down with you. That's not taught, and it's really hard to teach, dare I say, because some of that's a personality aspect. Um, but that's really the element I feel that makes a company, especially dentistry, successful. Because when patients walk into a practice, whether we like it or not, they can sense the mood.
Every time.
And it's like I don't know if they could sniff it in the air, they could taste it or whatnot, but man, if there's a bad day and people are pissed and stressed off, every patient knows it.
Mm.
And if that's consistent, like you're going to continually be dealing with overturn of staff, you're going to be losing people, and then your life is miserable. And that also led me to the realization that I spend more time with the people I work with than I do my own family. And I know people are like, oh, that's terrible, Travis, but like step back and calculate how much time you spend with your team, especially if you're doing 5 days a week sort of thing. And I also realized that when I have people on my team that are dragging me down, that means they're also dragging other team members down. And and as much as I hated to admit it, regardless of what their skill set is, if that's the attitude they bring to it, they're making my life miserable. And every day that's gone by, I will never get it back. And I'm getting older and older. And I have to be in an environment that I enjoy being in. And you know, like the old Gary V, you know, he's always like, hire slow, fire fast. And I'm like, it's easier said than done. You know, I'm like living within the realms of law and this and that. But man, it's there's a lot of truth element to that.
Mhm.
Like surround yourself with people that you believe in and you trust and you're glad to work with. And it's amazing how much more effective you will be at leading them. And they will be so much more receptive to follow your mission and be an extreme owner. Show up and say, the success that guys do as a team, this is the team success. But if we have a failure, that means I did something wrong. I didn't give you the tools. I didn't train you. I didn't extend to you what I value. And you know, then there's the outlier situations where like, okay, this needs to terminate. But um, yeah, the that challenge of working with people, uh, that's that also led me to like you come into play in that regards. You are a coach, a leading coach in dentistry, like especially helping people through the KPIs, especially helping, you know, through the business financial side of it. But I'm embarrassed to say that I wasn't smart enough early on to recognize that Olympians, professional sports players, high-end CEOs, the more demanding positions are, the more coaches these individuals have. So why am I going to sit here running a 1.5, $2 million entity, think like I got it all on myself. I don't need a coach. Like, like it's silly. It's absolutely silly. You're just like shooting yourself in the foot. And now like I have two coaches. I'm just completely flip-flop the other direction. And man, if I could give any advice to anybody, especially if they're starting out, or even if they've been practicing 25 years, I don't care. Everybody's at a point in their life where you can use a coach. And I'm not saying just somebody that sits down like, okay, let me look at your numbers, like, which is important. I mean, obviously, like you're like super sharp on that. But there's the other aspect of dentistry. There's the psychological aspect. There's the how do you deal with compartmentalizing that? How do you go home? Are you taking this all home with you, or is it affecting your home life? Um, there's too much opportunity for depression and people feeling like they're an island, they're alone, and we're perfectionists by default. I mean, like majority of us that go into dentistry, like, we want to sit around and everything just be perfect, 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 perfect. Just, blah. Like you can't sit there and say that doesn't wear on a person. So get those coaches in your life and let them help you. And you will find that allows you to be a better leader and actually help other people more so. And it's tough to admit weaknesses. I'm the world's worst at that, but
That's part of it, man. So everybody watching here, everybody listening, we're going to be bringing Travis back on for a season worth of stuff because, if you go back and listen to what he was just kind of going through, he kind of hit on everything from, he's doing multiple things. He's practicing at the top of our profession. He's bringing in a team. He's taking care of them. He's doing great things. Obviously, he's successful and making money doing this, but he's helping people. He's helping his practice. And what he just took it all the way back down to was leadership, right? Was how does he lead people? And before you can lead people, you have to lead yourself. Right. You have to get there and understand what you want to do and make it happen. Book, you brought up extreme ownership. The other part of that one, I just finished the book, was the dichotomy of leadership, right? Is saying sometimes you have to do things that suck, that you want to do because of all these other reasons. And so the dichotomy there of being able to be a great boss and run a great business, start other businesses, do other things does take time from a family and all that kind of stuff. That's a reality. That's something we all deal with. And it can weigh on us, right? The depression and dentistry, all that kind of stuff. But knowing that we have it for a cause and being okay with that, saying, hey, I'm going to change the world of dentistry, right? And that's your goal with XChart. I'm going to change the world of dentistry. So here today, we're going to wrap this up. We're going to make sure that we get this done. Travis, you're coming back to me, man, just because, we haven't talked in a while anyway, but we're going to be doing a part 2 of this. And like I said, we might do a season with you, buddy. But please, guys.
Like I said, man, like anybody can reach out to me. I went from being completely closed up to I'm completely vulnerable, and it's been a blessing for me. But like I said, if I can help one person out, it's all worth it.
There you go, Nifty.
There's a lot to learn from my mistakes. Don't repeat them.
Love it. Good, guys. Well, we're going to be bringing him back. We'll touch base from there. Nifty Thrifty, thanks for joining. Make sure you know this guy. We're going to be linking to him. He's going to be coming back for us. So
love y'all. You guys are the best.
All right, guys. We'll talk soon.
Thank you.
I'm going to call you, man. We're going to get kicked here. See you, buddy.
See ya.